viewers, today I would like to acquaint you with the topic access to sanitation through my lecture. Access to sanitation, its relevance of sanitation and hygiene. A direct relationship exists between water, sanitation, health, nutrition and human well-being. Consumption of contaminated drinking water, improper disposal of human excreta, lack of personal and food hygiene, and improper disposal of solid and liquid waste have been the major causes of many diseases in developing countries like India. Sanitation, women and children's concern. An additional concern in the context of the above relates to the differential burden the current situation places on women. Women in rural area, as in most parts of the world, often suffer from lack of privacy and harassment and need to walk large distances to find a suitable place for defecation in the absence of household and appropriate neighborhood toilet facilities. In several cases, they are known to wait till early morning or night before venturing out in the open, causing health problems such as urinary tract infections. These also have significant implications for attendance and enrollment of girls in schools. Moreover, according to the United Nations estimates that there are 2.5 billion people who still do not use an improved sanitation facility and a little over 1 billion practicing open defecation. In 2011, almost two-thirds, that is 64% of the world, relied on improved sanitation facilities. Since 1990, almost 1.9 billion people have gained access to an improved sanitation facility. The greatest progress has been made in Eastern Asia, where sanitation coverage has increased from 27% in 1990 to 67% in 2011. This amounts to more than 626 million people gaining access to improved sanitation facilities over a 21-year period. However, current trends show Sub-Saharan Africa and Southern Asia still struggle with the low sanitation coverage. In Sub-Saharan Africa, 44% of the population uses either shared or unimproved facilities, and an estimated 26% practices open defecation, while in Southern Asia, the proportion of the population using shared or unimproved facilities has declined to 18%, but open defecation remains the highest of any region. Open defecation rates declined globally from 24% in 1990 to 15% in 2011. In absolute numbers, this signifies a drop of 244 million people to 1.04 billion in 2011. The decline in the population practicing open defecation has differed from region to region. Eastern Asia, Southeastern Asia and the Latin America and Caribbean regions have been a steady decline since earliest measurements describing conditions in 1990. In Southern Asia, the population practicing open defecation peaked around 1995, after which it declined. Only in Sub-Saharan Africa is the number of people defecating in the open still increasing. The state of sanitation remains a powerful indicator of the state of human development in any community. Access to sanitation bestows benefits at many levels. Cross-country studies show that the method of disposal of excreta is one of the strongest determinants of child survival. The transition from unimproved to improved sanitation reduces overall child mortality by about a third. Improved sanitation also brings advantages for public health, livelihoods and dignity, advantages that extend beyond households to entire communities. Definition: basic sanitation means the facilities that ensure hygienic separation of human excreta from human contact. They include flush or pour flush, toilet excreta to piped sewage system, a septic tank or a pit one, ventilated improved pit system with slab, composting toilet. The background of sanitation in India. One of the major challenges faced by India has been providing access to sanitation, especially in the rural areas. India being a vast country, the assets created spread over a wide area, making it difficult for the government departments to maintain them efficiently and effectively due to both financial and physical constraints. Also, the rural population considers the assets as a government property and they do not come forward to maintain it themselves, making the system unsustainable. A sustainable solution was to decentralize the system and make the beneficiaries stakeholders in the system, one in which the local community and users are motivated to become stakeholders by sharing a part of the capital cost. According to the expectations and the needs to scale up reforms in the water sector throughout the country, the sector reforms program was improved and launched as Savajal Dhara in 2002. The scheme empowers the Panchayati Raj institutions and local communities to generate resources and equips them to plan, implement, use, maintain and replace the water supply schemes themselves. The scheme also provides full ownership of drinking water. A study on economic impacts of inadequate sanitation in India. World Bank Water and Sanitation Program, December 2010. This study from India analyzes the evidence on the adverse economic impacts of inadequate sanitation at the national level using information on health and other impacts. This study underlines that not only are substantial investments needed, but that these can be more effective only when they result in reducing morbidity and mortality, mitigating impacts on drinking water, improving welfare and reducing impacts on tourism and so on, which are associated with inadequate sanitation. The study recommends a new monitoring framework at the national and the local levels, one that measure not just toilet coverage and use or coverage of sewerage and other number of wastewater treatment plants, but also the improvements in the overall health, water related, environmental and welfare indicators that are caused by inadequate sanitation. The recent progress in India. The World Bank on December 15, 2015 approved $1.5 billion loan for the Swachh Bharat Mission Support Operation Project to support the Government of India in its efforts to ensure all citizens in rural areas have access to improved sanitation, such as a toilet with a focus on changing behaviors in ending the practice of open defecation by 2019. Specifically, this project will support the rural component known as Swachh Bharat Mission Gramin over a 5-year period using a new performance-based program which links funds directly to the results, ensuring that benefits are delivered to the people in need, more than 60% of India's rural population. Today, of the 2.4 billion people who lack access to improved sanitation globally, more than 750 million people live in India, with 80% living in rural areas. More than 500 million of the rural population in India continue to defecate in the open, suffering from preventable deaths, illness, stunting, harassment, and economic losses. The Swachh Bharat Mission Gramin program focuses on ensuring usage of toilets along with their construction. States and their implementing agencies will be given incentives for meeting performance standards. Performance will be measured against the state's ability to reduce open defecation, sustaining their open defecation free status, and improving solid and liquid waste management in rural areas. The financing mechanism promotes the leadership of the states, which will have flexibility in innovating and adopting their own delivery models. 1 in every 10 deaths in India is linked to poor sanitation, and studies show that low-income households bear the maximum brunt of poor sanitation. This project, aimed at strengthening the implementation of Swachh Bharat initiative of the government, will result in significant health benefits for the poor and vulnerable, especially those living in the rural areas, said Ono Ruhi, World Bank Country Director for India. Incentivizing good performance by states and the focus on behavioral changes are two most important components of this project, he added. The Ministry of Drinking Water and Sanitation will play the overseeing and coordinating role for the program and support the participating states. Funds will also be used to develop the capacity of the Ministry of Drinking Water and Sanitation in program management, advocacy, monitoring, and evaluation. India has demonstrated extraordinary leadership in pursuing the ambitious Swachh Bharat Mission campaign and embracing the focus on behavior to complement the construction of toilets, said Annette Dixon, World Bank Vice President for the South Asia region. It is our privilege to support the Indian government in this initiative, and we look forward to working side by side. The World Bank will also provide a parallel $25 million technical assistance to build the capacity of select state governments in implementing community-led behavioral change programs targeting social norms to help ensure widespread usage of toilets by rural households. This program, built on lessons learned from global and national sanitation projects, represents a fundamental change in approach and recognizes the importance of coupling investments in the construction of toilets to its usage. For it to succeed, large-scale social mobilization of behavior change is critical at the community level, says Soma Ghosh Malik, lead water and sanitation specialist and the project's task team leader. Third-party assessments and regular monitoring will provide reliable information on the project's process. He added, progress towards the key indicators which will form the basis for releasing incentive grants to states will be measured through independent verification assessments. National annual rural sanitation surveys will be carried out annually by a third party. The project will also finance specific activities to strengthen the current monitoring and evaluation system to capture timely, relevant, and reliable information on the program's progress. Support will be provided by systematic knowledge sharing and innovation, as well as capacity building and partnership. The loan from the International Bank for Reconstruction and Development, that is IBRD, has a maturity of 18 years, including a grace period of 5 years. Second, the new urban sanitation policy. Changing mindsets is often harder than changing technology. In a new initiative, the Government of India emphasizes behavioral change alongside technological advances as the key effective sanitation. The Ministry of Urban Development has announced an award plan as part of this initiative to promote cities and local bodies to achieve total sanitation. The Nirmal Shahar Puraskar Clean Cities Award, designed along the lines of the Rural Sanitation Reward Scheme, honors cities that achieve total sanitation, including the open defecation free status and 100% safe waste disposal. At the national workshop to launch the policy, Mr. M. Ramachandran, Secretary of the MOUD, said the policy attempts to address the many institutional issues, the plight of the urban poor, especially the manual scavengers, the lack of awareness on sanitation, integrated planning, and the lack of technical know-how and capacity, which causes most of our infrastructure facilities to not operate efficiently. According to 2001 census, almost 26% of the urban households do not have access to sanitation, and untreated wastewater from households account for 80% of the pollution of the surface water. The MOUD consulted widely in formulating the National Urban Sanitation Policy in order to tackle these issues. In 2005, an interministerial national task force on universal sanitation in urban areas was formed to frame the national policy. Representatives included other ministries and states along with academics and NGOs to formulate a holistic, pragmatic solution to the sanitation challenge in India. A national task advisory group on urban sanitation has been established to mobilize governments and civil societies to create community-driven Nirmal Shahars or totally sanitized cities and towns. The Ministry of Urban Development MOUD also developed guidance notes for states and cities to design strategies detailing key issues, financial and social indicators required for implementation. States and cities must change collective behavior regarding sanitation to ensure sustainability of resources, and accountability for doing so is made local. World Bank Water and Sanitation Program provided the Ministry of Urban Development with technical and logistic support. A key highlight of this policy and the award plan is that the focus is not on infrastructure development alone, but on outcomes and behavioral change. Under the policy, all states are required to develop state sanitation strategies according to the national guidelines. 6 states have already started doing so, and 1 city has started a city-wide sanitation planning process, also in line with the policy. Scaling up rural sanitation. Findings from the Impact Evaluation Baseline Survey in Madhya Pradesh, India. World Bank Water and Sanitation Program, March 2011. The goal of the WSP Global Scaling Up Rural Sanitation project is to reduce the risk of diarrhea and therefore increase household productivity by stimulating demand for sanitation in the lives of the people in India, Indonesia and Tanzania. This report summarizes the findings of the baseline and community surveys conducted in Madhya Pradesh, India, and is a part of a series of papers analyzing the baseline data for all countries where the program has been implemented. Summary of the major initiatives to promote environmental sanitation in India. Ministry of Urban Development, Government of India has drafted the National Urban Sanitation Policy. Vision for urban sanitation in India is all Indian cities and towns become totally sanitized, healthy and livable, and ensure and sustain good public health and environmental outcomes for all their citizens with a specific focus on hygienic and affordable sanitation facilities for the urban poor and women. Policy focuses on important sanitation issues such as poor awareness, social and occupational aspects of sanitation, lack of integrated city-wide approach. Ashwas, a survey of household water and sanitation, was a participatory survey that covered 28 districts of Karnataka, covering more than 17,200 households across 172 GPS. This was a people's survey. The surveyors were selected from the respective communities that included students, women from self-help groups, local NGO partners and other volunteers. In Mumbai, Observer Research Foundation conducted a study of sanitation facilities and the state of cleanliness at all Mumbai's 109 suburban railway stations. The study has unmasked the wretched condition of toilets and urinals in most of these stations on Central, Western and Harbour lines. Such types of initiatives by general public are important to initiate some action by the government by acting as the pressure groups. Strategies that should be adopted to improve sanitation. First, school sanitation and hygiene education. School sanitation has been introduced with three major objectives. There is requirement of toilet facilities in schools, especially for girls. In absence of such facility, higher dropout rate among children, especially girls, is noticed. Children can adopt hygienic behavior fast and will lead to change in hygiene behavior in their generation, as children are good change agents. This can influence the family and community for adopting sanitation and hygienic behavior. For this purpose, intersectoral coordination among the departments such as education, health, women and child, tribal welfare, social justice is needed. The way forward: building the political will, further popularizing the Nirmal Gram Puraskar, building and institutionalizing human resource capital, focusing on behavior change communication in all total sanitation projects, developing social marketing strategies and promoting alternative delivery systems in order to accelerate the sanitation coverage, developing schools and Anganwadis as vehicles for expanding the outreach of this program. Empowerment has been initiated and resulted in quality improvement in the construction and improved operationalization of hygiene education. As far as schools and Anganwadis are concerned, these will be covered much earlier with the support of funds under the Total Sanitation Project and Sarva Shiksha Abhiyan, for which already efforts have been made. It is proposed to cover all schools and Anganwadis. Solid and liquid waste management. It has been recognized that solid and liquid waste management of the rural household has a major impact on the overall sanitary environment of the villages. In recognition to this, solid and liquid waste management has been included as part of the total sanitation program, and 10% of the project cost can be utilized for this purpose. Third, availability of finance. As discussed in the preceding paragraphs, Government of India has increased the budgetary support for rural sanitation considerably, and adequate funds have been provided for this program. Similarly, majority of the state governments have started making adequate provisions for their corresponding state share. Fourth, creating an enabling environment. So far, sanitation coverage has been lagging primarily because of the lack of priority attached by the state governments to the program. In order to accord higher priority to the program and creating an enabling environment for the same, ministers have already taken up matters with all the chief ministers, MPs and MLAs. Distribution of the Nirmal Gram Puraskar by the President of India has further energized the PRIs, and more people are coming forward to work for sanitation promotions. Fifth, emphasis on IEC and capacity building. Since TSC implementation required intensive IEC for demand generation for sanitation facilities and capacity building for all the stakeholders at different levels, lot of emphasis is being given on IEC and capacity building. For this purpose, communication and capacity developmental units CCDUs have been set in the states. Technical support and guidance to the TSC projects. Since the approach of implementation has been drastically changed from the supply driven to demand responsive participatory approach, various types of technical support is being extended to the states and TSC projects by way of issuing technical notes, e-newsletter, knowledge sharing through internet, etc. Nirmal Gram Puraskar. Incentive for community mobilization, TSC, implementation requires social mobilization of all the stakeholders, the PRIs, that is the Panchayati Raj institution, key opinion leaders and NGOs working at the grassroots level play a catalytic role in sanitation promotion. Nirmal Gram Puraskar is being given to seek their greater participation in the sanitation promotion. Those PRIs which completely eliminate the practice of open defecation, provide water supply and toilet facility to schools and Anganwadis, and maintain general cleanliness are eligible for the award. Distribution of the Nirmal Gram Puraskar was given by His Excellency Dr. APJ Abdul Kalam, President of India, had motivated a large number of PRIs to take up sanitation promotion. This has created a movement at the grassroots level. Added to this is the incentive scheme launched by the various state governments. This has set the priority of all the state governments, and it is strongly felt that the sanitation coverage will take tremendous amount of acceleration. Monitoring of program. The emphasis given on the monitoring of the process of the projects by engaging independent district level monitors in each district has focused on the process parameters and also given useful feedback to the government, which is helping in taking required corrective measures. Conclusion. To conclude, environmental sanitation is an important determinant of health situation of the country, state and other subunits of the population. So far, environmental sanitation was somewhat neglected by all, including governmental authorities as well as general public, but as its importance is now well accepted globally, important incentives are started by the government as well as the community. It is also essential that these incentives are taken together by all persistently for the betterment of mankind. I sincerely hope this lecture proves to be informative and enlightening for all the viewers. Thank you.